This video is presented by the Rutgers Global Tuberculosis Institute. The video explains what TB infection means. Sophia was just diagnosed with TB infection. TB infection may also be called LTBI or latent TB infection. Sophia has lots of questions. If I have an infection, why don't I feel sick? Could I have made other people sick? How did I get this? What should I do now? Let's answer these questions. TB infection behaves a little differently than most infections, which can be confusing. TB infection means that Sophia has TB germs in her body that are alive, but her immune system is able to keep them contained so that they don't cause her to be sick. However, her body's ability to keep the germs contained may change at any point if Sophia develops other health issues or if her immune system weakens. While these germs are contained, they will not make Sophia feel sick, and she will not show TB symptoms. Unless she becomes sick with TB disease, Sophia cannot spread TB to anyone else. TB is spread through the air from one person to another when someone who is sick with TB disease coughs, sneezes, speaks, or sings. People are most likely to get TB infection if they spend a lot of time with someone who has TB disease. This could be a family member, a coworker, or anyone else that they spend time with. However, it's often not possible to be sure where the infection came from. Someone who has lived in or traveled to a country where there is a lot of TB has a higher chance of being infected. This is true even if they were there many years ago. It's possible for TB germs to live in a person's body for years without them knowing it. Sophia wonders, what should I do now? If Sophia does not receive treatment for TB infection, it may someday turn into TB disease. This happens when the germs break free of the barrier created by the immune system. Uncontained germs can multiply in the lungs and may spread to other parts of the body. If Sophia develops another disease that weakens her immune system, such as HIV, diabetes, cancer, or kidney disease, she will be at a higher risk of becoming sick with TB disease. Some medications and treatments could also increase her risk. For example, steroids, TNF-alpha blockers, chemotherapy, and other immunosuppressing medications. People who drink alcohol and smoke also have a higher risk of developing TB disease. If Sophia does develop TB disease, she will become sick and have symptoms such as a cough, fever, night sweats, loss of appetite, and weight loss. Without treatment, TB disease can be a serious, life-threatening illness that can cause permanent damage to the body. It is much easier to treat TB infection now than it would be to treat TB disease in the future. If Sophia becomes sick with TB disease, she may also spread the germs to others, such as her family and friends. They may become infected with TB and need treatment as well. To prevent this, Sophia can take treatment for TB infection now and lower her chances of becoming sick with TB disease. Sophia's healthcare provider can help her find the right treatment plan. Then, by taking medicine as prescribed, Sophia can cure the infection. After treatment, Sophia's body will remember the infection and may still react to the TB skin test and blood tests. However, the infection has been cured and will not turn into TB disease. Sophia should keep documentation showing that she completed treatment for TB infection. She may need to share this with healthcare providers or employers in the future so she does not have to get tested or treated again. Starting and completing treatment for TB infection protects Sophia's future and the future of her loved ones. TB infection can be a confusing diagnosis. Like Sophia, you may have questions and concerns. Talk to your healthcare provider so that you can get the information and care you need. For more information about TB, visit this website for the Centers for Disease Control and Prevention.